AASI combined with mito-organelles, the MO super transfer factor, extremely successful in treatment of eczema. Another publication, a very interesting case, extremely successful use of AASI. In this case, it was combined with another immunomodulatory agent, super transfer factor. I suggest to look into this also, the MF Plus product called super transfer factor, a fantastic product that helps a lot in various allergic autoimmune conditions as well. It's in viral and bacterial, chronic bacterial infections and viral infections. It is known to stimulate NK cells, increase their production amount within the first 24 hours after administration. And this case is a case of the eczema. We know that it's an inflammatory skin disease characterized by the coin-shaped, well-defined erythematous plaques with lesions that may manifest as papules or vesicles and all. And this case report presents a case of nominal eczema on a male patient treated with corticosteroids, both topical and systemic, for years without any signs of improvement. Thus, alternative and complementary treatments were provided by the FCTI laboratories, the active specific immunotherapy, and the MF Plus mito-organelles MO range of super transfer factor were prescribed for the treatment of this particular individual. And by combination of both therapies, both AASI and STF could successfully modulate the immune system and heal the skin lesions. The hyperpigmentation subsequently became less and less, and many of them have completely disappeared, as well as the erythematous plaques have disappeared completely. And it's quite turned up to be an extremely effective treatment modality. You can actually see here what were the topical and systemic medications that the patient was on. As I said, the treatments were ongoing for years. The lesions, these eczema lesions, were all over the body: trunk, front, the back, the abdominal area, upper, lower limbs. And the treatment protocol was quite interesting. In fact, there were two AASI protocols. The first course of STF every other day for 1 month, and a course of AASI, 30 vials, given every other day, so it took 60 days. There was some improvement, but not complete disappearance of the skin lesions. And when the second protocol was given, the second course, second line of the AASI therapy, again 30 vials, and again together with the STF, that took another 60 days. And that second round of AASI treatment combined with mito-organelles, the MO super transfer factor, has produced a dramatic effect. You can see the before and after pictures. The transition from that wet, moist eczema to almost complete clearance, with first it dried out, then lesions were slowly disappearing. However, there were some pigmentations left, and subsequently even pigmentations were reducing, much reducing, and almost disappeared completely. And by the way, until now, there is no return to systemic steroids, systemic anti-inflammatory, any systemic medications at all in this case. And the patient is in remission for quite a number of years since the second round of the AASI and the MO STF was given.